colleagues. This is Dr. Marcelo Cury, plastic surgeon from Brazil. I am specialist in eyelid, orbital, and lacrimal system surgery. I'm very glad to say you that we are launching our 5th edition of my course, The Art of Eyelid Surgery, and this time it's gonna be everything in English, so we can allow people doctors from Asia, from Europe, and from America to join us and be part of our family. We are already more than 150 surgeons around the world talking about and learning about eyelid surgeries, including brow lift, include endoscopic surgeries, and also reconstructive surgeries like eyelid malposition, ectropion, and tropion ptosis. So it's a very, very good and complete course, and we are launching our 5th edition next February 20, so be part of our family. Good evening, everybody. Buenas noches amigos de Latinoamérica. ¿Me escuchan? ¿Están me escuchar? Can you listen me? Can you hear me? Buenas noches. Well, hope you guys are listening me. I will talk in English because it was combined before, so hope everyone can understand. The lecture has subtitles in Spanish, so don't worry. For Latin America Latin America doctors, colleagues, don't worry, because there is subtitles in Spanish, and I am very happy, and it's an honor for me to have you here this night. I will give you a very brief presentation about my career and about my course, The Art of Eyelid Surgery, and then we're gonna pass and gonna have the class. The class is about almost 20 years of experience in facial and eyelid surgery. So I will share with you knowledge. I will share a few my mistakes. I will share a few mistakes I've done during my career, mainly during the pre-op analysis, during the surgical plan. And of course, sometimes if you do the wrong surgical plan for that specific case, you're gonna end up with a not so good result. You can don't have complications as ectropio and tropio, as I didn't have, but it's not a very, very good outcome. And of course, we need to have very good outcomes. We need to have outstanding results to have more patients and to increase our career and to have more patients in our office. So I will share with you the secrets, my vision, the secrets of the analysis, what is important to pay attention to do a very good surgical plan. So let me share with you my screen and to do a brief presentation with you guys. So again, thank you so much to be here. It's a pleasure for me. It's an honor. I will give my best to this night be very, very productive and very useful for you guys, for your career and your surgeries. So the masterclass is going to be how to avoid complications and achieve better results, better outcomes in eyelid surgery, and also upper third rejuvenation. So it's not just eyelid I will talk about for you. A little brief. Yes, this is what I already said. How to prevent complications and achieve outstanding results in eyelid surgery and rejuvenation of the upper third of the face. So on the end, I will open the registration for the 5th class, the 5th edition of the Art of Eyelid Surgery, my course. The course already has 2 years. We are almost 200 surgeons from all around the world. I think 15 or 14 countries. So a lot of people, a lot of doctors with me, learning and improving and being better surgeon. So it's a very honor for me. Who is Dr. Marcelo Cudi? This is just a brief presentation. My career, my specialization. I did plastic surgery with Dr. Pitangui here in Rio de Janeiro. I live in Rio de Janeiro and work here. I did my first specialization in eyelid orbital and lacrimal system in Fluminense Federal University here in Niterói with Dr. Roberto Sebastián and Guilherme Herzog in 2009. And after that, I've been in New York with Dr. Richard Liesman. I've been in Boston with Dr. Freytag, in Massachusetts Eye Infirmary. I've been in Michigan with Dr. Alon Kahana, a mentor for me. It's an outstanding surgeon from Michigan. So I did many specializations in this field, in this field of plastic surgeon. Nowadays, I'm full member of the Brazilian Society of Plastic Surgeons, and I'm in charge of the ophthalmic plastic surgery in Brazilian association this year and the 2024 and 2025. And I am also the chief staff on the orbital eyelids and lacrimal system department on Employees Federal Hospital in Rio de Janeiro, where I do a lot of complicated cases, orbital surgery, lacrimal system surgery, eyelid surgery, just complex and challenging case I have over there, as it's a public hospital in Brazil. I've been working with Dr. Pitangui. I've worked with him for almost 10 years. It was 9 years, 3 years as a student. And then I worked beside him as eyelids, taking care about the eyelid surgeries over his institute. So it was a pleasure and a very, very good opportunity to learn with him and be with him and take a little bit of his knowledge. I host and have a lot of students, a lot of doctors from all around the world to see my surgeries, to exchange knowledge, and of course to learn with them, and also to teach also something to teach also my knowledge about this surgeries. And why I create the Art of Eyelid Surgery? 2 years ago, of course, it's a long journey, and I always saw a lack of a poor education, a lack of quality on the education about eyelid surgery, about periorbital surgery, even in ophthalmologist residence programs and also in plastic surgeon programs. So it's in Brazil, it is very common. Most of the residence programs don't teach deep oculoplastic surgery, eyelid surgery. So it's a lack of education in Brazil, and I think also in Latin America, it's a problem. So I have a lot of surgeons asking me and asking my opinion about cases, and of course I am available for everybody, but it's not possible to everybody to come to Rio and see surgeries with me and learn with me in present. But and and that's why I choose to create the art of eyelid surgery, to spread, to share my knowledge in this field with people all around the world. So the art of eyelid surgery, it's a mentoring program. We have a very wide program, and it include it include static surgeries. It includes reconstructive surgery, as ptosis, ectropion, entropion, eyelid malposition, and eyelid reconstruction. It includes anatomy of the region, surgical anatomy. It includes the aging process. I teach the aging process of the face, because I do believe that it's very important we know deeply about the aging process, because if we know the aging process, we know what we have to do to indeed rejuvenate our patients. So it's a very complete course. It's a mentoring, discuss case every week. We have a one live surgery, one live class once a week on Wednesday, and I'm available for discuss cases from the students, and also from my case, to learn and share my knowledge with you guys. So this is important regulations. I have to talk to few. This is exclusively for doctors. No problem with other professionals, but it's exclusively for doctors. Of course, it's not a method that will enable you to become an eyelid surgeon without adequate practice and application of the techniques acquired. You have to work hard. Of course, you have to study. You have to watch good surgeons, and I am available for that, to build a solid career, and to build and to be a good surgeon. And at the conclusion of this masterclass, I will create opportunities for the fifth group, as I already said for you. Now we're gonna share the lecture with subtitles in Spanish. Hope you guys like, and in the end, I will be back to answer the questions. Okay, thank you so much. Good evening, everybody. So again, it's a pleasure, it's an honor for me have you guys here. Thank you so much to spend your time and be here in this night with us. What I'm showing to you this night is about almost 20 years of experience dedicated to eyelid and facial surgery. And I want to give you some tips and tricks to avoid complications and achieve better results in your eyelid surgery, in your facial surgery, in your upper third rejuvenation. So hope you guys enjoy and be part of our family, the art of eyelid surgery. So this is my disclosure. I have a mentor program I already talked about for you. We are already almost 200 surgeons around the world. learning and talking and watching videos about eyelid surgery and upper third facial rejuvenation. We are already in 15 countries. So we have students from 15 countries around the world. It's a very honor and it's a very honor for us, of course. So talking about the periorbital aging process and the aging change, there are many causes of the aging of the periorbital area. And probably the most important are volume loss, deflation, and muscle laxity, and also some ligaments laxity. Of course, there are changes in the skin. Also, there are some bone resorption, fat annihilation. And what I mean is to achieve a very good and natural result, we have to address all causes to have good results and also natural results. Studying about the aging process and looking for articles and papers talking about, we can see the Rodrog paper about the prediction of facial aging using the facial fat compartments. And what I highlight for you guys is the facial fat as a structural support for the face. It influences both also volume and shaping. So the fat we lose in the middle third. It's a very important structure to keep volume and shape on the eyelids. In the outer opinion, facial fat atrophy in facial aging carries greater significance than soft tissue laxity and osseous change. So it's very important, the process about deflation and volume loss. So there are many fat pads in the middle third of the face. Some of them are superficial, some of them are deep, and we are losing these fat pads during our aging process. And of course, it occurs in different times. We begin losing fat around the eyes, so in the periorbital aging. In this article, in this paper, the facial aging process from the inside out, I highlight some phrases also for you to understand what are the characteristics of a youngful and beautiful face. So if you look in the first highlights, no Asian youthful face include large almond-shaped eyes. This is very important. Cheek fullness, a curvilinear profile, and some considerations about lips and lower third. Aging graceful may be synonymous with retaining fullness of features. This is very important. Smooth facial contours and gradual transitions between facial areas. When we have shadows between areas, this is aging signals. So this is aging characteristics. The young face, when we are young, there are no shadows. There are no shadows between the areas in our face. So it's really very important to understand. So you know what you are looking for in your surgery. You have to do in your case, to have this kind of situation, this kinds of results. Again, there are many of fat pads in our face, and we are losing as we are aging. We are aging. So another highlights for you: shifting occurs from bone remodeling as the fat pads move with the bone chains, and from weakening of the support ligament. So also support ligaments laxity, fat atrophy, and also fat migration, deflation. This is really important in facial aging process. Look the pictures of Brad Pitt. He is in the 30s or 40s. He is in the 50s, and he's in the 60s. So look his eyebrow, how it's going to be dropping, and how the hollow still increase as he's aging. So the shadow between the lid and cheek is increasing. So this is a sign of the aging process. Look this case. This patient, I've done his operation, his eyelid surgery in the beginning of my career, maybe almost 20 years ago. He complained that time. He complained about the hook eyelids, and also about the lower eyelid. So I've done skin, upper bleph with skin removal, lower bleph with a little bit fat removal, transconjunctival approach, what I've done, I've still done, and I love it. And look what I didn't realize that time, that he already had this temporal droop. So this is a sign of Cornell. It means it's not about skin in the eyelid, but it's about the temporal aging, the frontal temporal aging process. So to achieve better result in case like this, you have to address the temporal area. Otherwise, you're gonna have a poor result, as I had that time. Look, I did his surgery. I removed skin. I removed a little bit bags in his lower eyelid, a little bit skin in his lower eyelid, but I didn't rejuvenate him. I did not rejuvenate him because he's still with a droop in the temporal area. He's still a sagging eyebrows. He's still with a lid cheek junction, very, very markable, with a shadow in the lid cheek junction. So I did the surgery, but I did not rejuvenate him. Look, the coilosinal is still there. This lady, it's also the same. I did her surgery. I did her bleph, upper bleph, lower bleph, and I did not rejuvenate her because I didn't approach his eyebrows, his temporal area, his frontal temporal area. So she already had corneal sinal, and I didn't address it. So I didn't rejuvenate her. So what I'm saying is, do surgery is different from rejuvenation. To rejuvenate your patients, you have to do the right things. And just operate, it's not guarantee of a good result for you. You have to do the right things. Remove skin, remove fat, will not give you a good result. So this is a research I'm doing in Google about the most beautiful eyes in the world, and look all of these pretty and very beautiful women. All of them, there are some specific characteristics of her eyelids, but all of them have one characteristic. It's common for all of them. Just Jessica Parker, the 10th, all of them have fullness in the orbit. So volume is very important. This is a very good tip I wanna give for you guys. Lid surgery, eyelid surgery, it's about detail. So it's very important you analyze your patients in a close-up view. You have to see details. You have to see some asymmetries, some details, and you need a close-up view. Otherwise, you can't see this kind of details. So the area is about the forehead, the middle third of the face, and the eyelids. You have to close this region to see details in your face, in your patients. This is a profile view, and you can see as the molar, there are a curve profile in the molar with a volume in the molar area. So, and also a very smooth transition between the lids and in malar area. So it's very important to achieve this kind of characteristics to give your patients good result and rejuvenate them. So this is very important. The hallmark of beauty and aging process on face are lights and shadows. So please, no flash in your eyelid pictures, in pre-op and also post-op eyelid pictures. Otherwise, you're gonna miss some details in your patients, and of course, it's not fair. So you have to do the right pictures to see some details and can give your patients better surgical plan. This paper talk about festoon and analyze some pictures of the patients and conclude the same thing I've talked to you right now about flash. So looking at the same data without flash compared with flash, score were higher without flash. So it means that without flash, you can see better some details and some lights and shadows of the face. And then, of course, you can plan better your surgery. So the conclusion of the paper is the same I'm talking to you right now. So look, it's a festoon assessment, of course, but without flash. Look, these patients, it's the same patient without surgery. The left picture with flash, the right picture without flash. Probably, if I see the photo with flash, on her left side, I will not remove bags in the eyelid, in the lower eyelid, probably. But if I see her picture without flash, I'm pretty sure I will remove a little bit fat on her lower eyelid, because there are some bulky, some lights in her lower eyelids about fat herniation. And look how the hollows, the shadows are, you can see better the shadows of the right pictures than the left picture. So please, in these situations, no flash. Look, the same patients with flash and without flash. Look, the malar mount, her malar mount, it's worse, of course. in the photo same without flash. In the photo with flash, her molar mounts are mute, but without flash are more severe. So it's very important to pay attention in this detail. The exception is ptosis. Why? Because you need to know the MRD1, so margin reflex distance 1. This is the distance between the eyelid margin and the flash on the pupil. So this is the only exception, ptosis. It's very important. So every time I'm addressing, I'm seeing patients with ptosis, or even if the patient doesn't realize that she has ptosis, and I can see some small asymmetries, and I'm not sure in the exam, but I take photos with flash. I take picture with flash so I can see in details if there are some ptosis, 1 millimeter of asymmetry or not. There are no ptosis, so it's important, and it's very important you see and you talk with your patient about it before the surgery. I will show you some cases, some mistakes I've done, and I had to operate again these patients. It is very important, some pictures, primary gaze position, looking up, looking down, because you can see better your ptosis. You can see, looking up, better your fat bags on lower lids and asymmetries. So this is very important. Photos, close eyes, of course, and it's very important, the profile, right profile and left profile, because you have to know your vector, your eyelid vector. This is very important to plan your surgery. So look, this guy, this male patients from right, from left, and the lady from right. They are completely different patients. The surgical plan I will do for him, it's completely different I will do for her. And why? Because he is a negative vector and she is a positive vector. This completely changed the game, completely changed the surgical plan. This guy, it's a high risk of eyelid retraction, of scleral show, of eyelid ectropion. So I will not remove skin in his lower eyelid. This lady, it's okay, and I can remove a little bit skin. I can remove. I can do some pexy, some cantopexy, and it's okay. I have less risk to have eyelid malposition with her than I have with him. So this is very important to take photos from profile view of your patients. I like the 3/4 views to see the eyebrows. So it's a very good incidence. It's a very good picture to see the eyebrow. I take with the 3/4 view very frequently. So look this case, this photo, a student from the mentoring sent in the group. We are always discussing case, and she told she did the blepharoplasty in this lady, and this lady was complaining about her eyes, about she think her eyes are smaller and horizontally smaller. And the surgeon asked me why she's complaining about her eyes are smaller if she has a very big eye. She has a big eyes and big eyelid shape. So what I've done, I did a zoom in the picture to see the canthus, the lateral canthus, and look the lateral canthus of the patients. There are almost 9 degrees of the lateral canthus. What it means, with the surgery, she took skin out, and with the scar contraction, she has a partial descent of lateral canthus. So what happens is, horizontally, the length of the eyelid is lower than it was. So of course it's smaller. Sorry, it's smaller, not lower. It's smaller than it was. So yes, her eyelids are smaller than it was. So, and she was complaining. So that's why it's very important. You see the details. You close your pictures. You close and see your pictures in detail. So this patient, I've done her surgery also. This is a pre-op view. I didn't realize the sulcus, the upper fold asymmetry, and I didn't take photos with flash. So what happened? I removed skin. I did her lower eyelid also. Look, her post-op. She already had this post-op with flash. So look, she already had a very slight ptosis, a minimal ptosis on left side. I didn't see it. Her sulcus, his upper fold on her upper eyelid was already higher position. And I didn't realize. When I took the skin out, it's getting worse. It became more visible, the sulcus asymmetry. So what I had to do, I did another surgery on her, correcting her ptosis, and she's okay. But I had to do a second surgery without charge money, so it's not good. This is a very small detail. I missed it, and I had to do another surgery. So on my pre-op exam, I put here some 8 topics very important to you to avoid complications. Listen your patients. The best result is your patient happy. So listen what bothering them, what she complained, what is the expectation about the surgery. It's very important. Be aware for existing problems. Ptosis, as I show you, eyebrow ptosis, asymmetries, lights and shadows, and talk with your patients. Show for your patients the asymmetries, and if you're gonna address this or not, it's very important. So snapback test to address the laxity, the ligament laxity, the muscle laxity, distraction test. For case you're gonna correct ectropion, or eyelid retraction, it's very important to know if there are some anterior lamellar deficiency, the anterior lamellar lack. Set your eyelid vector. I've told you about how important it is for documentation, as I said you, and in specific case, mainly for the facial palsy patients, set the facial mimic in a specific case. I mean, dynamic situations. It's important in some specific case. So look this case. This guy, this patient, came to me because he has ectropion and tearing and eye irritation, redness eye. So he want improve and solve this problem. So, but look his eyebrows, how asymmetric they are. He's almost 80, 76, I think. And it is very important to address and to talk with him and to talk with your patients. What about the expectation about your forehead, your eyebrows? Because they are very different, and it's difficult to have a good symmetry in the eyebrows, even done a very good brow lift. So I asked him about it, and I will show you in a couple of minutes the result. And we decided to don't touch, because he told me, Marcelo, I'm living 76 years with this asymmetry. I'm here not for this. What's bothering me is the tearing, my eyelids are pulling down. So okay, this is very important. Look this case. I did the surgery of this patient also. The second picture, it's about 30 days after the surgery. She was very, very happy and yes, very, very exciting about the result. And then 3 months after the surgery, she sent me this picture. So it's swift, because it was a self picture, and showing me this arrow about this shadow, this like a hole, it's a shadow. And if you see the picture, of course the row it's pointing the left side, so the picture are shifted because it was a self. If you look the pre-op photo, the pre-op picture, she already had that shadow, and I didn't see it. So I could correct it in the surgery, but I didn't correct it because I didn't see. I didn't pay attention. So look the result after a year. The sulcus asymmetry is still there, and it's bothering her. And it's also not a good result. It's a like a fair result, but it's not a good result. So I had to do the second surgery without charge. So it's not good. This picture, what I've done, I remove a little bit skin, and I've done micro fat graft on her upper eyelids. So we achieve a better contour, a better light contour. So, and also more symmetry between the upper sulcus, the upper folder. This picture she sent me last week. She lives in Miami, so sorry for the picture quality, but she lives in Miami, and she sent to me. This is what I've done. Look this case also. Sagging eyebrows, heavy eyebrows, very, very small distance between right eyebrow and eyelid. So I did her surgery. I did her upper and lower bleph, and I did a directed approach to the eyebrow. I did Castanharis procedure, modified. It's a procedure I like it, but it works for the lateral part of the eyebrow. And look how she is in the post-op. Of course, she's not happy. Of course, because I choose the wrong technique for her case. Because why the castanharis here, it's a wrong technique? Because what she's need is increase the distance also from the central part of the forehead, also the central part of the eyebrow, and not just the lateral part. So the castanharis doesn't work for the central part of the eyebrow. What I have to do, what I should have done is a brow lift. And in this case, I should have done endoscopic brow lift. I will teach you guys endoscopic brow lift in the course, in the mentoring program with edited videos. It's a very safe and very good, predictable surgery with an amazing result. So what I had to put her on the operating room again and do the endoscopic brow lift to give her a better result. So it's a mistake because I choose the wrong technique for address this kind of sagging of heavy eyebrows. Snapback test, all of you know how to do it. It's very important to know the laxity of your lower eyelid, about ligaments and also muscle. Distraction tests, of course, all of you also know. It's very important. This patient has ectropion, and I'm examining, I'm doing her plan, surgical plan.
Esse é o teste para avaliar a lamela anterior da pálpebra.
Anterior lamella
empurrando a margem
test.
palpebral para cima.
Look.
E preciso fazer muita força para atingir a pupila. Agora eu vou avaliar a lamela posterior.
Sorry. Look how it's difficult to achieve to put the eyelid margin on the pupil. I can't do it. So this is a sign that is the anterior lamellar lack. So to correct this kind of tropion and or eyelid retraction, you have to increase vertically your anterior lamella. You have to do skin graft. So this is very important to plan your surgery.
Esse é o teste.
Set the eyelid vector, operate the man above. It's completely different than operate the woman below. I already talked for you about it. Look, these patients, the surgeon who did his surgery don't know about it, because remove skin did not correct the laxity of the ligaments and also the muscle, took too much fat on his eyelid, and didn't realize he is a negative vector patient. So did the wrong surgery and had a very bad result. These patients also the same. Look how hollow and pulling down her lower eyelids with eyelid retraction, and also the man the same. So this is very important. The flower concept, the flower rule about leave at least 20 millimeters in the upper eyelid. This is very important for prominent eye patients, for patients with negative vector. In patients with positive vectors, you can leave 18, sometimes 17. You're going to be fine. You're going to be safe. But in patients with prominent eye, I recommend you to leave at least 20 and maybe 21 in some patients, because you're going to be safer and achieve better result in this patient. If you took too much skin in patient with prominent eye, you will have worse appearance of the prominent eye. So it's not a good idea to remove very much skin of the patients with prominent eye. So look, this lady came to me complain about tearing and eye irritation after a bleph surgery. Her surgeon sent to me and asked me to help her. And look, she's slightly negative vector, and the surgeon took too much skin of her eyelid, and now she has 13 millimeters, 14 millimeters. This is catastrophe. This is disaster for upper eyelid. So it's she didn't realize she is a very slight negative vector, took a lot of skin. When you take a lot of skin of your patient, you bring your eyebrow down. It's always happen. So it's not about take skin. You have to also contour and increase the position and get better position of your eyebrow. And the other, there are 70. So in the upper bleph in prominent eye, it's very important to have a good amount of fat also. What I remove on the preseptal fat, on the post-septal fat, the pre-proneurotic fats, is just a small amount in front of the orbital bone. So what I want is the fat covering the superior orbital bone, superior orbital margin. So it's a very small of fat we take out. And microfat graft in some case is very important also. So prominent globe is a common cause of lower eyelid retraction. As a general rule, lateral tarsal strip with cantoplasty by itself, it's an ineffective way to treat eyelid retraction in these patients. So because you can't shorten your horizontal length of your eyelids in patients with negative vectors of prominent eye. I will teach you in the mentoring program also about it. So on lower blepharoplasty, no or less skin removal, CO2 laser is a good option to increase and have better skin quality, less fat removal, cantopexy or cantoplasty, depend of the case. Don't short your horizontal length of your eyelids. The efforts are to add vertical length for this lower eyelid. So be aware about it. Retraction muscle release, some cases with or without spacer grafts, and mid-face microfat grafting always in the spaces. It's very, very good for all patients and for special for this kind of patient, prominent eye patients. So look, this case, very interesting case. This is not my case. This is from this a very, very good surgeon from northeast of Brazil, and he has done his bleph and took a little bit of fat on her lower eyelid and did morpheus. Look, he is a negative vector. 1 month post-op, he was good. 3 months post-op, looking her lower eyelid, because remove the fat maybe more than should be done, and the scar contraction with morpheus what happened with eyelid margin? It's a scleral show. It's a retraction, eyelid retraction. So, and the surgeon did not remove skin, just did morphos and remove fat. So pay attention, be cautious with this kind of patients, negative vectors. This patient, very negative vector. This is my patients with a very it's a severe eyelid retraction, scleral show. So in this case, I talked to her to have a good increase in vertical length of her eyelid. I would use spacer graft, and I like too much the hard palate. So this is what I've done. Tarsal suspension, so cantoplasty without shortening the eyelid margin with spacer graft from her hard palate and microfat graft on malar area. So we achieve a better position of her eyelids. On left side, I would say perfect. On left side, on right side, not perfect, but much better. And what is very nice about the periorbital microfat graft is we left negative vector situation to a neutral vector situation or a slightly negative vector situation because we add molar support. So this is very important and very good for this kind of patients. Look, this patient, the same, without spacer graft. Look her eyebrows. How close is are the eyebrows from the lids? And what I've done is tarsal suspension, cantoplasty, endoscope brow lift, and microfat graft, periorbital microfat graft. So this is a nice result. This is a natural result because I did the right surgical plan. I did the right things. So this is very important. This guy is the same. He is a negative vector. This is not the profile view. Yes, here I have the profile view. Look, he's a negative vector. And what I've done, I remove a little bit skin, little bit fat, and add volume to the malar area. And we can achieve a smoother transition between the lid and cheek, and also a good tarsal plate position without surgical signs. Very natural. It's a male patient. It's more important to have very natural results. And we left the negative vector situations to a slight negative or neutral vector situation with periorbital fat graft. This patient also the same. It's a revisional case with lid contraction, lid retraction, scleral show. And this case, it's a very slightly negative vector. And my plan was what I've done was cantoplasty with a hard palate, spacer grafts, and microfat graft. But I did a small mistake in this case, and this is very important. It's a very nice tip I will give for you. When you have lid retraction and scleral show, and you have to bring tissue from the malar area, from the lateral malar area, to put the skin up, to bring the skin to position, to bring the lid for position, you're going to bring some tissues to the lateral canthus. So in this case, you have to do a brow lift as a compensation because you are bringing tissue to the lateral canthus, and then you have to compensate this tissue to avoid this kind of wrinkle. She didn't have pre-surgery. Of course, her eyelid is in better position She doesn't have eyelid symptoms, irritation anymore, but now she has a wrinkle, she has a volume, a buckle in the lateral canthus, and of course it's not beautiful, and of course most of patients will complain about it because this is a problem you were bringing for her. She didn't have, and you were bringing this problem. You can see, you can talk for her, but yes, but I bring your eyelid for a better position. Yes, you did, but you also give me a problem I didn't have. So in this case, nowadays, I do a brow lift to compensate. So look, this patient, very, very severe eyelid retraction with a, a mass in the lateral canthus. Lateral canthus, they sense post-bleph problem also. What I've done was a small, she's a positive vector patient. I did a small torsal strip with microfat grafts. And in this case, I did the brow lift to compensate. And look the result without that problem, without bringing tissue and causing the problem in the lateral canthus. So this is very important tip I would like to give you guys. And here is her result. So this is the video of the eyebrow, the brow lift, the temporal brow lift, and it's a very safe technique in the right hands with respecting some details. It's a very safe procedure and also very effective. You can have very natural result and very beautiful result with this technique. I will teach you this technique. There are a lot of videos, edited videos in the platform to the students, to the doctors who is attending the mentoring program. So it's a very, very safe technique and very good technique to reposition your eyebrow, your temporal area, and also your frontal area. And this is what we can achieve. Look, it's incredible. Without tension, you can achieve this movement. You can achieve this kind of result because all tissues are released. So this is the secret. I do believe this surgery, it's about release and not about fixation. Of course, I do some fixations. I will teach you in the mentoring program, but it's about release surgery. It's about release the ligaments, release the periosteum. Some case, look, hollow eyes, scleral show, positive vector patients. So look, microfat graft, brow lift, upper and lower bleph. Look how I left the round shape eyes to a almond shape eyes. It's very important to give your patients beauty, to give your patients good result. So this is what I've done. This is a short video about the microfat graft I use in the upper eyelid. It's also it's actually not upper eyelid. It's the upper orbit. I used to say it's the upper orbit fat graft because the graft I want to put the graft the fat merging the upper orbital bone, the upper border of the orbital bone, so of the orbit. So This is a very, very good, very predictable technique, and you're gonna be shocked with the result if you do properly. Well, this is a ptosis case, of course, and with these patients had a good response, a good phenylephrine test positive. So look her, look his eyebrows, look his ptosis, look his shadow on the lid cheek transition, look his bags, and look his result. What I've done: brow lift, upper bleph, conjunctival mylarectomy, lower bleph, micro fat graft. Look his result. Better eyelid position, better lid cheek junction, better eyebrow position. Look the lateral brow situation. Look his eyelid. And why I achieved this kind of result? Because I did the right diagnosis. I did the right things. I did the right surgical plan. This is the secret. I will teach all of these tips and tricks in the mentoring program for you guys. Look this lady. She's very beautiful. She's an actress in Brazil. How heavy is her eyebrows, the lid cheek junction, shadow, and look her result. It's a look surgery. Her look are very better. It's are better, and it's very beautiful. Look how smooth is the transition between the lids and cheeks, and how better is her eyebrow. So I did the right things. This is what I've done. That's that patients I show you in the beginning of the class. Positive vector, severe laxity, ligaments, ectropion, and also some bags and some static problems. And look his result. Better eyelid position, better lid cheek junction transition. So I did upper bleph, lower bleph, transconjunctival plus pinch, tarsal strip, bilateral, and periorbital microfat graft. I did not touch his eyebrow. Of course, he needs, but I talked with him before the surgery, and we decided don't touch it. He doesn't complain about his eyebrow. So I address what is important for him. This is a kind of rules I'm created for address complications in eyelid surgery. So I'm answering some questions I do for myself about laxity, about lamellas, anterior and posterior, about vector, and to achieve the best result, to choose the best technique to achieve the best result for this patient. There are many ways, there are many techniques to solve the problem, but for these patients, one technique is better than for other patients. And it's very important you answer this question before do the surgery, to choose the right surgical plan. This is very important, and this is what I will teach you in the course. Thank you so much. This is what I want to show you. show my mistakes I've done, show, of course, some cases I had very good result, what I do right, what I did right, what I did wrong, and hope you guys have enjoyed the class, and hope you guys come to be part of our family, to be part of the Art of Eyelid Surgery family. And this mentoring program, it's a like a son for me, and I take care of it with dedication and very uh, I really love this mentoring program. I really love to teach and to talk about and to learn more and more about eyelid and facial surgery. So thank you so much to be here, and thank you so much to stay with us. And I'm here to your question. Thank you so much. So, guys, hope you have enjoyed the class. Thank you so much to be here until now. I will share you a little brief presentation about our commercial and some things about the course. So, of course, it is a lot of information, especially for doctors are in the beginning of the career. But of course, it's possible to grow. It's possible to be a better surgeon, and this mentoring program is for it. If you are a person looking for uh, leave your comfort zone, if you are a person, a doctor looking for be a better surgeon, 1% every day, to be to grow your career, to build a solid base in your career, to be a reference. I'm pretty sure I will help you with this mentoring program. How can you implement these techniques and begin to observe tangible results? Of course, I can help you. I will help you in this mentoring program and give you a shortcut in your career. That's the reason I established and created the Art of Eyelid Surgery. I really love to teach and to share the knowledge. Of course, when we teach, we also learn. So it's a natural process. What the Art of Eyelid Surgery will give you? So you conduct a comprehensive and individualized assessment of patients for accurate eyelid surgery, as I showed you on the class, advanced surgical techniques, and we have a very huge and solid videos with edited videos, a videos library with a lot of techniques. The techniques I use on my day: cantopexy, cantoplasty, brow lift, endoscope brow lift, upper bleph, lower bleph, transconjunctival approach, cantoplasty, cantopexy, a lot of videos on our library. We are always updating the library and the videos, so it's a very good material to learn. We're going to mitigate complications and address any challenges that may emerge during the surgical procedure. Stay informed about the last advances in contemporary eyelid surgery. Accurate price in your eyelid, ensure a balance between the value of your time and expertise. We're going to have a bonus class about pricing, about economical pricing, and about economical manage of the office. So Adriana Martins is a special lady who teach me a lot and who support me in my office. So she's a very smart lady and will teach you about financial management in your office as well. Of course, the art of eyelid surgery, you will have the opportunity to execute upper facial rejuvenation procedures, including blepharoplasty, brow lift, endoscopic brow lift, microfat graft, CO2 laser, and of course, with efficiency, safety, and precision. Of course, you're going to have better result and more patients, more satisfaction patients. You will elevate your standing as a surgeon and augment the perceived worth of your service. If you're a surgeon seeking to enhance your expertise in eyelid surgery, I am pretty sure the art of eyelid surgery is for you. Is what you discover upon joining the art of eyelid surgery. So we have a very big program. It addresses the surgical anatomy, the surgical aging process, the process to do a very good surgical plan. So this I call a basic chapter, but it's very important to have a solid base to do the right things as I showed you in the class. The second part is about aesthetic surgeries. We're going to address upper bleph, lower bleph, brow lifts, many of approach for the blepharoplasties, fat grafts, cantopexy and cantoplasty. When do one technique, when do the other technique, mother mounts. So a lot of problems and a lot of situations we deal with in our practice. And the third part, it's about functional surgeries, about ptosis, eyelid retraction, entropion, ectropion, and also eyelid reconstruction. So it's a huge and very complete program. Yeah, that's and the worth about it. The worth about it, of course, almost 20 years. I spent a lot of money traveling, studying, and to specialize me, to grow my and to build a solid knowledge in my career. Of course, it's expensive and it's okay. What I mean, I want to give you a shortcut, and of course, cheaper than I spend to also you grow and build a solid career also for you, a solid base also for you. The official price of the art of eyelid surgery is $3,518, but for the class 5 today in the launch process, we are just starting the 5th edition. It's gonna be just $1,900. It's very good price. It's a very good offer to a very complete and huge and very solid course with almost 200 doctors are already attended it. So I am now sharing the link in the chat. Secure your spot. Don't miss this opportunity. And as I said, there is more. For the 5 first attendants, I will give you opportunity to come to Rio and visit me and share the operating room with me to observe my surgeries. Of course, the cost is by yourself, but I will not charge anything to you to come in and be in operating room with me for a couple of days. If you are a surgeon seeking to enhance your expertise in eyelid surgery, I'm pretty sure the art of eyelid surgery is for you. And I will enhance further. I will give you, as I told you, a bonus class about the financial management for offices and also pricing for doctors. It's a very important. You're gonna love Adriana. She's a very smart person and will help you to have a very good economic situation in your office. It's really important. Of course, we have a daily mentoring and discussion of clinical case through our WhatsApp group. We have a WhatsApp group with me, and I answer and I share my case. I answer your doubts. I answer your questions. I answer about your case as well. So it's completely included in the course. Of course, if you don't like, you have 7 days unconditional guarantee. So you can ask your money back and we're gonna do you all your money back if you don't like the course. To summarize what you will receive, this is the summarized the total value of this, but for you attending the class and until Sunday, next Sunday, the price is going to be $1,900. So it's a very good discount. It's a very good offer for you guys. The registration closed this Sunday, so don't miss it. Hurry up, don't miss it. Clicking the link I will share with you in the groups. Secure your sport and please feel free to ask me some questions and we are here to answer you. Thank you so much to be here one more time.